Hi guys, welcome back to another episode. We are meeting so back to back these days, and as I said, I would be coming with this video because I think this is very important. It's not so difficult, but somehow the topic, this localization of consolidation, kind of feels like a difficult topic. I don't know, I kind of felt it difficult too, so I'm just presuming that it must be difficult for you guys too, but it's really not that difficult, you just have to have a clear idea what's going on, and then it gets super easy. So let's make it easy for you. And today what I'm gonna do is I'm gonna make you practice with me. So if the question, I hope this question comes because it came in FMGE August 2020, but I don't think so, it came in December 2020. So there are high chances, like, they tend to ask alternatively some of the question and some of the topics, and since I feel it's an important topic and it's a good question, basically it's not so difficult, not so easy, and it's balanced, and it's one of the good questions. So I'm expecting they may be asking it, and if you have practiced it with me, then you would be answering it correctly, no doubt about it. It would become very easy for you. So let's get started right away. So what we have to do is first understand the basic anatomy of your lung so that we are able to localize it. To localize it, we have to know the anatomy at least. So this is your trachea, as we know. Here is your apex. This is what we need to know is the fissures, horizontal fissure and the oblique fissure on the right side, and on the left side, because the left lung is smaller than the right one, so there is only one fissure, which is the oblique fissure. And what we need to know is the lobes. So this is superior lobe, middle lobe, inferior lobe of the right side, obviously, and then the superior lobe and inferior lobe of left side. What I want you to focus in this picture is the lingula. Look, this part of the upper lobe, left upper lobe, looks like a tongue-like projection. So this is what we call a lingula. Please remember this lingula. That's all I want you to know. We would learn the application of it later. If you want to see the lingula here it is. The lingula is here. So you need to remember this one. Okay. So if you have been following me on Instagram, then I uploaded a small video making the 7 lines. That is just I did for you to have an idea what we are going to do in today's video. So this is what we are going to do. See, line number 1. These are the only things you need to know to crack the question. And it once you know these things, it's going to be really, really easy. This is what 1, 2, 3, 4, 5, and 6. The diagram I made on my Instagram page has had 7 lines, but there in this picture is only 6 lines, because I want you to tell me which is the 7th line. You would be able to tell me, and we are going to do active learning, because I'm just not going to speak and you're just not going to hear me speak. Okay, so we are going to use our brains as well so that it stays longer. So 1 is what? 1 is the border of mediastinum, right side, right? 2 is what? 2 is your aortic knuckle or aortic notch. 3 is your right border of heart, correct? 5th is your dome of right-sided dome of diaphragm, correct? Then we come to 4. Number 4 is your left border of the heart, and number 6 is respectively the diaphragm dome of right side. So now what the 7th structure is that I made in my diagram, but it's not here, is this one. Yeah, right here, lateral border of descending thoracic aorta. So tell me, where should I be drawing the 7th line if I have to draw the 7th line? So what we discussed is this is the arch of aorta. Pardon me. Okay, so if this is the arch of aorta, then you see this line coming down here. I hope you can see it, this faint line. If we continue this here, if I continue this here, this is your descending thoracic aorta, which we are going to number as 7. Okay, so these are the only 7 lines you need to remember, and then it's going to be super easy. Now, it is this principle of localization of consolidation is based upon basically your Silhouette sign. Silhouette sign is what? When you can see a border, you can see a border properly. That is silhouette basically. But what silhouette sign is? When you cannot see a normal border. What I mean is that See, this is a bone, this is your rib, right? You can see the lung here. This black one is the lung, this white one is the bone. So you can see the difference between the bone and the lung, right? This line, if I may say, this line is differentiating the bone from the lung field. So it has a silhouette, but if this would be intermingling, and if you cannot differentiate the bone from the lung, then this would be called as silhouette sign. Okay, so let's dive into it. What do I mean by that? If number one, your mediastinal, right mediastinal border is missing in the picture, don't worry. If you are confused right now, we are going to practice the questions in just a minute and you'll understand it very nicely. Okay, if one is missing, if you cannot differentiate this from this, then what lobe is involved, what lung lobe is involved in the consolidation, like where is the consolidation present? So this would be as if there's right upper lobe. So right upper lobe is involved if you cannot differentiate from here to here, correct? If you cannot see the arch of aorta, this aortic knuckle, then which lobe is involved? Your left upper lobe is involved. Okay, let's go to 3. 3 is what? Right side, a right border of heart. If you cannot differentiate right border of heart, if you cannot see right border of heart in a chest x-ray, then where is the consolidation? Like the consolidation will be here somewhere. So which lobe is it involving? It's involving right middle lobe, not the lower lobe. Please do not get confused in it. This looks like lower lung, but this is not a lower lobe. So this is right middle lobe. Let's go to 5. If the dome of diaphragm is not seen, right sided dome of diaphragm is not seen, then what it is involving? Then it is involving the right lower lobe. Okay, likewise number 4, if this part, what is this part? This part is your left sided, right left border of heart. Okay, if you cannot see left border of heart, then the consolidation is involving lingular region. This is where we saw the lingula was. Okay, and if the left dome of diaphragm is not visible, like you cannot differentiate where is the left dome of diaphragm clearly in a picture, then it is involving left lower lobe. As simple as that. Okay, 1 right upper lobe, 2 left upper lobe, 3 what was 3? Right middle lobe, correct. 4 lingula, 5 right lower lobe, and 6 left lower lobe. As simple as that. And what about if the number 7 which we drew here, descending thoracic aorta, you cannot differentiate it's there or not? So in case you are not able to differentiate the descending thoracic aorta, then the structure which is involving is left lower lobe. This is not upper lobe, then this is the left lower lobe. It involves the left lower lobe. Okay, so let's dive into the questions. So first is RLL consolidation. Don't look at this, let's see this. Can you see the left border of mediastinum? Right border of mediastinum? Yes, you can. Can you see aortic knuckle? Not so good, but kind of. It's not all disappeared. Can you see the border, left border of heart? Yes, I can, I think. Can you see the left dome of diaphragm? Yes, you can. Can you see the right dome of diaphragm? No, you cannot. So if you cannot see the right dome of diaphragm, what was this? Number 5, that is right lower lobe is involved in the consolidation. Okay, easy. So loss of right hemidiaphragm here. Dense opacity in RLL. Dense opacity is what your consolidation is. Okay, let's go next. Can you see here the border? Yes, you can. Can you see knuckle? Yes, you can. Left border? Yes. Left diaphragm? Yes. Then right diaphragm? Yes. You cannot see the right border. What was the right border? Anyone remembers? Yes, it was RML. So right middle lobe is involved in this CXR. That is all they are going to ask you. That is all you have to answer. If you know those 7 lines and what lobe they mean of, you're done with it. Ho gaya kaam. You'll be good for it. Okay, next, these I haven't given above what it is, so you can use your active brain right now, because once it's written upside, then we tend to go it there. So let's practice it. You can see the left side, right border, correct? Right, everything is visible, 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 visible. Right dome, visible. Okay, never mind. Let's go from down. Hemidiaphragm, visible, correct? This left heart border is visible. This is your descending branch of descending thoracic aorta, visible. Aortic knuckle is not so visible. You cannot see a clear border. So the consolidation will be involving what? The area of aortic knuckle, which is left upper lobe. Good. So this is what? Left upper lobe. Consolidation, left upper lobe consolidation. Pardon my handwriting. Okay, my handwriting is not so good, so just ignore it. I hope you can read it. Let's go to the next one. Okay, in the next one you can see the right sided mediastinum border. Yes, you can see the right side mediastinum border, the right border of heart. You can see right diaphragm, dome of diaphragm is visible. See, you see the aortic notch or aortic knuckle here. You cannot see that aortic knuckle, the good contouring here, but you can see it clearly here. So that is also there. Can you see the left bordering of heart, where the heart is finishing and where it's ending? Not so good, right? It's like, compare this image with this one. It will be easier for you to understand that. I can't see the proper contour here, but can you see the diaphragm, the lower diaphragm? Yes, kind of, little bit. Not that good, but it's not that bad as well. I can still see the dome of diaphragm is there, but very, very little. So the consolidation is probably involving a lot of area, but what majorly it's involving is your left heart border. So left heart border is what? Or what are you going to answer? Left heart border involving what lobe? What consolidation position is this? Are you going to say left lower lobe? No, you can't say left lower lobe, because if you say left lower lobe, it's going to be involving the dome of diaphragm, left side of dome of diaphragm. So no, it's not left lower lobe. It is left upper lobe, which is the lingular region of upper lobe. Okay, let's see the lingular region again. Let's go back here. This one, this is your lingula, this is your lingula. It seems like it's coming down, okay, like left lower lobe mein aa raha hai, but it's not left lower lobe, it's still left upper lobe. So the heart border, here is the heart, so this will be forming the contour. If here in the lingular region there is a consolidation, then the left bordering of the heart disappears. Okay, that is it. That's all you have to learn. What I want you to answer is one question for me, okay, and give me the answer in the comment box. What is Chilaiditi sign? First question. This is the major question. If you can answer Chilaiditi sign, I'm happy with it. And if you could tell me what is the feature added with Chilaiditi sign that it becomes Chilaiditi syndrome. So actually it's two questions, but it's one question only. So if you can tell me what is Chilaiditi sign and what salt we are adding it in, like what feature is added to make it turn this ingredient into a recipe, which is Chilaiditi syndrome. So thank you so much for being here with me for another video. I hope you like it. I hope you find it useful. If you like it, please like, comment and subscribe. I would be really grateful. And if you have any other request, and if you find anything really difficult or any concept or anything, you can text me on my Instagram page, which is SHENIOR19. You can search me there, and I'll be very glad to help you as the time permits. I'll try my level best to help you. Thank you so much.